Good evening, dear doctors. Today we are going to talk about some of the growth related disorders, growth and its assessment, and the clinical correlates. This will be mainly based on OSCE related discussion, and I hope it will be very useful for you in the upcoming OSCE exam as well as whatever licensing exam you appear in the future. So let's start. The first concept you need to know here is what are the periods of growth in childhood. This is the most basic thing here. Okay, so the first thing is what is ovum. Okay, what is ovum? Now, ovum means from the time of fertilization up to 2 weeks. This is called ovum. After that, what is embryo? Okay, embryo is from 3 to 8 weeks. This is of course intrauterine life. Okay, after embryo they will ask you what is fetus. Now fetus or fetal period is from 9 weeks up to birth. 9 weeks up to birth is called fetal period. And now the baby is born. Okay, so after the baby is born, it is neonate or the newborn, that is from birth up to 28 days of life is called neonate. Now what is infant? Infant is up to 1 year. Okay, up to 1 year is called infant. Now what is toddler? Toddler is 1 to 3 years. 1 to 3 years is called toddler. Now preschool age child is from 3 to 6 years. Okay, now school age child, okay, school going age or school age is 6 to 12 years. Okay, quite easy. And one of the very important question is what is adolescent? Okay, or adolescence period, that is from 10 to 19 years. Now the students, this is very important point. Okay, this has been asked multiple times in previous FMG exam or whatever licensing exam you appear, and it is again divided into 3 parts. Okay, early, okay, mid and late. Okay, early adolescent period is from 10 to 13 years. Now mid is 14 to 16 years. Okay, and this is 17 to 19 years. Okay, so this is how we know the periods of growth in childhood. Okay, this is a very important thing. So in the OSCE exam, we can easily ask some of the questions from here. Let's move further. The second is what is a perinatal period? What is the perinatal period? Another very important question here. So without wasting any time, let's discuss about it. Now, perinatal, peri means around and natal means the birth. So it starts from 22 weeks of gestation till 7 days after birth. Okay, so this period between the 22 weeks of gestation till 7 days after birth is called perinatal period. Perinatal period. Remember, this is a very important concept. Okay, so let me utilize some of the time here and talk some of the important concept once again. So if the pregnancy discontinue before 20 weeks, if pregnancy discontinue, we call it abortion. It can be spontaneous or it can be induced. Okay, now 22 weeks is considered the start of period of viability. Okay, period of viability. The period of viability starts after 22 weeks. So that's why the perinatal period is also considered from that moment. Now another very, very important period, the question will be actually 34 week. You know why? Because the surfactant, okay, surfactant production is almost complete. at 34 weeks of gestation. And if the baby is born after that, the chances of hyaline membrane disease will be very less. Okay. Now, if the baby is born after 37 week, okay, till 42 week, you see this is called term baby. Term baby. If the baby is born prior to 37 week, it is called preterm baby. And if the baby is born after 42 week, it is called post-term baby. Now, these are other very, very important terms here. Okay. Now, one more thing here. Now, the baby is born and up to 28 days called neonatal period. We all know. And this neonatal period is also divided into two parts: early neonatal period and late neonatal period. Now, what is the difference here? Early neonatal period is up to 7 days, of life, and late neonatal period is from 8 to 28 days. Okay, so these are some of the very important point, dear students. You must remember this, okay, or you must know this. Let's move on. Now, we directly go to the instrument now, and these are the very catchy question in the exam. Now, see here, identify the instrument which is shown here and what is the use. The name of this instrument is called infantometer. Infantometer. And what is the use of this infantometer? It is used to take the length, of the baby up to 2 years of the age. Up to 2 years of the age, because we believe up to 2 years the baby cannot stand, okay, properly. The baby can stand, but not properly. That is the point. So still, we take the recommended length, and that is done by infantometer. Okay, nothing much to discuss here. They may ask you what is the difference between length and height. Height is the term we use only when the baby is able to stand properly, and height is measured by stadiometer. Remember that. Height is measured by stadiometer. Okay, so this also can be shown to you and ask the question. Now let's move on. Another one, what are the different types of international growth chart, and which growth chart is shown here? It's a very easy question, but it is very, very important one, because the pediatrician can ask a lot of different concept from here. Okay, so this is developed by World Health Organization or WHO, and this is called weight for age chart for boys. Okay, weight for age chart for boys, and this is up to the 2 years, and these are the percentile chart. Okay, so a little bit of concept about this different type of international growth chart. Here. Now, the first type of growth chart was developed by NCHS in 1977. So this is a National Center for Health Statistics. Okay, this is the institution of United States, and this institute develops a growth chart for the first time in 1977, and after that, okay, Center for Disease Control, CDC, revised it in 2000. Okay, in 2000, and we followed this for quite a period of time, and then ultimately World Health Organization of WHO revised this again in 2006. Okay, now both those NCHS and CDC, they were developed in the American children, whereas this WHO chart is basically developed in many different countries. Okay, many different countries, and it is mainly developed from under 5 years old children, under 5 year age old children, and mainly those children were breastfed. Okay, breastfed. Earlier in CDC and NCHS, they are mainly formula fed children, but these are the breastfed children. This is a big difference here. And this study was done in multiple countries, and the name of those countries, sometimes you can get this type of question also. Number 1 is Brazil, okay. Number 2 is Oman, okay. Then Norway, okay, Norway. Then Ghana, then United States of America, and in India. In India, especially, it was done in Delhi, okay. So these are the countries where this study was done, and this is also known as multicentric, okay. This is MGRS study, MGRS study, okay, multicentric growth, reference study, okay. So this is very commonly, followed all over the world these days. Now let's go back. So of course, this is now very easy to answer. This is a WHO type of chart. So what we do, we ask the age of the child, and then, for example, the age of the child is 1 year here, okay. Now we take the weight of that child in front of us with the help of weighing machine, and then we plot the weight in this chart, and then we see where this falls, okay. If it is near to the 50th percentile, it is absolutely fine, it is absolutely normal. But still, there is a big range. If it falls above the 3rd percentile and below the 97th percentile, it is still considered fine, okay. So but remember, one reading may not give you a lot of idea. You need to follow up the child, take multiple weight, and then plot and look at the direction or the velocity of the growth curve. This is an important point here, okay. Now let's move on. Now look at this picture here. The question is, this newborn baby has head circumference of 35 centimeter, head circumference of 35 centimeter. At the end of 6 months, what would be the expected head circumference? So this type of question with the help of this picture, and the options are also given to you: 44, 42, 46, and 40. Now, how do I solve it? Okay, now see here. So for this, we need to know some important points here. What is the rate of growth of the brain in early neonatal period or early infantile period? Now head circumference at birth, okay, at birth is around 33 to 35 centimeter in a full-term baby, okay. Now in first 3 months of life, it grows 2 centimeter per month, and after that 3 to 6 months, okay, it will grow 1 centimeter per month. Now this will be enough for you to solve this question. The question, once again, I like to show you. At the end of the 6th month, what would be the expected head circumference, okay. So let's solve it now. So at the time of birth, it is 35, they say, okay. So first 3 months, it is 2 centimeter per month, that is 6 centimeter it would be, and another is 1 centimeter for another 3 months. So let's add all this together. So this is 6 and this is 3. So it is ultimately 44 centimeter, right? 44 centimeter. So where is the 44 centimeter here? It is 1. Okay, this is 44 centimeter. So this is how, dear student, you need to solve this. This is very, very common question which will be asked in multiple exams. Okay. Now some clinical correlates regarding the head circumference. The clinical correlates would be, if the head circumference is very big, okay, in comparison to the age of the baby, what would you suspect? And that is called macrocephaly, okay, macrocephaly. And there are some very important causes for macrocephaly, okay. We don't go into the detail now because we don't have much time. It will consume a lot of time, and that is not the purpose of today's class. But still, few important points: hydrocephalus, hydrancephaly. Hydrancephaly means there is no brain, and the brain is replaced by a big sphere-shaped containing cyst, okay. Then another may be the big brain itself, big brain itself, which is called megalencephaly, and sometimes the very thick skull bones. Okay, some of the concept. So we will talk about this later in some other class. Let's move on. Now another question, number 6, is, look at this. This is called upper segment and lower segment. Okay, so what is the normal upper segment to lower segment ratio at birth, and what is the use of it? These are the two questions. If this type of OSCE is asked, it is very easy. You should feel lucky if this question is asked. So the answer are, the normal upper segment to lower segment ratio at birth is 1.7 to 1.9 to 1. Okay, this is at birth. Now at 3 years, okay, at 3 years of the age, it will be 1.3 to 1. Okay, 1.3 to 1. It's like this. Here, 3 to 1. Okay, it's easy. 3 for 3. Okay, then at 9 to 10 years, it will be 1 to 1. And after that, the lower segment will be longer than the upper segment, so it will be 0.9 to 1. Okay, so these are the important questions which will be asked to you. So what is the use of it? What is the use of it actually? The use is, sometimes the child will be of very short stature or very short height, and we want to know which type of short stature is this. Is it proportionate short stature or disproportionate short stature? So for that we need to calculate the upper segment lower segment ratio. If the child is very short and the child is maintaining the upper segment and lower segment ratio, okay, that is called proportionate short stature. Whereas if the ratio is not maintained, it is altered, and the child is very short, it is called disproportionate short stature. Now disproportionate short stature can also be of two types. Okay, see here, disproportionate short stature. Let me repeat again. Disproportionate short stature का मतलब क्या है? Sometimes we use a bit of Hindi in between, so that some student can understand easily. But of course, I'll explain everything in English first. So disproportionate short stature means that normal ratio which I just talk is altered, okay, or change, and the child looks very short. So it is short trunk disproportionate short stature, okay, one, and another is called short limbs disproportionate short stature. Okay, now here the example which is very important from the exam point of view. The short trunk disproportionate short stature, okay, would be mucopolysaccharidosis, okay, something known as hemivertebra, when vertebrae are fused with each other, some disease of the vertebral spine like Carey's spine, where there is collapse of the vertebra, some of the important example. Whereas the short limbs, the classical disease like achondroplasia, rickets, okay, hypothyroidism, these are the classical one. Okay, and if they ask you, can you give me one example of proportionate short stature, the two conditions which are very, very familiar here, are very easy for you to memorize, are the classical dwarfism, which is caused by growth hormone deficiency, and severe malnutrition. Okay, so many others are there, but these are catchy one to remember. Now let's move on to another question. See here, number 7. What classification is this, and what is the use of this tape which is shown in the picture? Now first I'll start with the name of this tape. This is called Sakir tape. Okay, Sakir tape, and this Sakir tape is used, okay, it is used by the community health worker, community health worker, to measure the mid-arm circumference of 1 to 5 year old child. Okay, and why this mid-arm circumference is taken of 1 to 5 year old child? This is one type of anthropometric measurement which tells us that how many of them are malnourished, how many of them are healthy. That type of research, if you want to do in a community level, then the Sakir tape is very commonly used. Now remember, just look at this. There are 3 zones here. This is red, the color itself is shown here. Okay, this is red. Now another, okay, here is yellow. See this area is yellow, so yellow color is not commonly seen here. Okay, that's why I'm using another thing. And this is green. Okay, this is green. So there are 3 zones here. Okay, now see here, if the mid-arm circumference falls in the red zone, then this is severe malnutrition. Okay, and it is usually less than 11.5 centimeter. Yellow is borderline, this is borderline, and more than 12.5 centimeter is normal. It is normal. Okay, now another question, see this, what classification is this? This is called Arnold classification. So this is very, very common question which has been asked multiple times, dear student, and exactly this type of questions will be asked from here. Okay, let's move on. Now number 8. Okay, number 8, name of this instrument and what is the use of it. The name of this instrument is Harpenden caliper. And this is mainly used for the measurement of subcutaneous fat. Because measurement of the subcutaneous fat is one of the anthropometric measurement we can use to see the nutritional status of the child. Okay, and this subcutaneous fat is mainly measured in triceps area, in biceps area, in suprascapular, and subscapular area. Okay, these are the areas where this is usually used. This instrument is used, and you can clearly see how this instrument is used to measure the thickness. And there are different type of classification. The normal one, when the subcutaneous fat is more than 10 millimeter, it is normal. Okay, now between 10 to 8, then 8 to 6, then less than 6 is severe malnutrition. Okay, so between 10 to 8 is mild, 8 to 6 is moderate, and less than 6 is severe type of malnutrition. Okay, so this type of knowledge is enough here. Now another one is name this curve which is shown here in the picture. This is one of the favorite questions from the pediatric side. Okay, now see there, these are the different types of growth curve of the different tissues and organs in our body. The first one is A. This is brain growth. The second is called somatic growth. Okay, somatic growth. The third one is lymphoid growth, and the fourth one is called gonadal growth. Okay, now a little bit of elaboration on this. The majority of the brain growth, almost 90% of the brain growth, you can see it here, occurs within first 2 years of life. Okay, so this is a very important period in the growth of that child. Okay, if a serious malnutrition occur in that phase, or some micronutrient deficiency occur in that phase, then brain growth will not occur properly. Okay, the baby may suffer from intellectual disability. Regarding the somatic growth, okay, see here, in the first 2 years of life, it is a rapid growth. Okay, then at the age of puberty, it is rapid growth again, and in between that, it slows down, but it is still growing, but it is slowing down. So this is called S-shaped curve. or we can also call it sigmoid shaped curve. Sigmoid shaped curve. Okay. The third one is a lymphoid growth. You can clearly see here between the age of 4 and 8 there is maximum lymphoid growth in the child. Okay, and most of the lymphoid organs are hyperplastic or hypertrophic during this time. So when we examine the child, the lymph nodes would be palpable. So that means it's a physiological growth. It is not because of any infection. Okay, and then this is gonadal growth. At the time of puberty, the gonadal growth is maximum. Now, what are the names of these curves? Okay, this is a favorite question. This is called Scammon's curve. Scammon's growth curves or Scammon's curve. Okay. Now, number 10, name of this chart and its uses. Now, what is the name of this chart? Clearly see here. This chart is used to classify what type of newborn is delivered. This is called Lubchenco chart. Lubchenco chart. Okay, Lubchenco chart. Fine. Now see this. This is the gestational period here, and this is the weight of the baby. So when we, according to the gestational age or period, we take the weight of the baby and we plot the weight in this graph or curve. Now, if the weight of the baby falls below the 10th percentile, okay, this is called small for gestational age or small for date baby. Okay, normally it falls between 10th to 90th percentile, which is called appropriate for gestational age, okay, or appropriate for date. And when it falls above the 90th percentile, it is called large for gestational age babies or big babies. So these are some of the very, very important concepts from Lubchenco chart. Now, dear students, please remember one thing. Sometimes, the baby is not low birth weight, but still the baby is small for gestational age. And small for gestational age and low birth weight or IUGR are not the same term. There is a difference between them. Okay. Yes, in majority of the cases, SGA is IUGR, but sometimes, it may not be the same. It may not be the same. Okay. So let me stop here for today, and we'll continue again, in the upcoming days. Thank you.